Okay, we are live. Good afternoon, everyone. Today's session is going to be really helpful and it's led by Dr. Shweta from Apollo Cradle and Children's Hospital. She is going to talk about UTI, urinary tract infection in pregnancy. So stick around until the end and ask us questions if you have any. Let's not keep you waiting any longer. Doctor, you have the stage.
Yeah. Thank you. I'm Dr. Shweta, consultant obstetrician in Cradle, Rajajinagar, Bengaluru. Today we'll be speaking about urinary tract infections in pregnancy. Urinary tract infection in pregnancy is one of the common infections that we see during some point of pregnancy. Why today we'll be discussing why urinary tract infection is common in pregnancy and why is it important that we diagnose it and treat it, and are there any measures to prevent urinary tract infection from occurring. Okay, urinary tract infection as such is seen in 2 to 10% of pregnant individuals some point of their pregnancy. Now, urinary tract infection, if not detected or untreated, can lead to a lot of complications for both mother as well as for the baby. Okay, why urinary tract infections are common in pregnancy, or for the matter, female? Urinary tract infections are common in female because of the shorter urethra and the proximity of the urethra, close proximity of the urethra to the vulva and vagina, where the contamination is usually more and cross infection can occur. Okay, and in pregnancy, as such, pregnant women are at an increased risk of developing these urinary tract infections, because in pregnancy there are certain changes that occur in a pregnant woman, which is for making sure the growing needs of the fetus. There is increased blood volume and increased cardiac output in pregnancy, because of which there is increased renal blood flow. Okay, or the blood flow to the kidneys are increased. So when there is increased blood flow, there is increased urinary production. So you will have increased urination and increased frequency of micturition. And also the pregnancy maintaining hormone, that's progesterone, causes relaxation of the musculature in the body during pregnancy. That includes even for the ureter muscles also. The ureter becomes atonic and a little dilated. The urinary bladder, as such, the tone decreases and the capacity of the urinary bladder increases. Okay, the pelvic musculature also relaxes, and even the sphincter urethra, the muscles which control the opening and closing of the urethra, also relaxes. So what happens in the early pregnancy? The growing uterus put pressure on the bladder, so there is increased sensitivity in the bladder, so increased frequency of urination. And the second thing is, during advanced stages of pregnancy, the presenting part of the baby puts pressure on the bladder neck, which gets stretched. Along with that and the sphincter urethral muscles weakness, there is incontinence, stress incontinence, which is quite common in pregnancy and more so occurs when there is increased intra-abdominal pressure, like coughing and also. So there is small amount of dribbling, which also puts the pregnant women into increased risk of developing urinary tract infection. And since there is increased blood flow to the kidneys, the renal tubules sometimes fail to reabsorb or doesn't completely reabsorb certain amount of amino acids and glucose. So what happens? They're more excreted into the urine. So when there is more in glucose and amino acids in the urine of a pregnant patient, so the urine acts as a very good culture media for the bacteria to grow. So hence, women is more predisposed to develop urinary tract infection. Now, when we're talking about urinary tract infection, we categorize them basically into three stages. Asymptomatic bacteriuria and cystitis, which is nothing but the infection of bladder or the lower urinary tract, and pyelonephritis, which is the infection of the kidneys or the upper urinary tract. Now, asymptomatic bacteriuria, this is the most common that we see. As the name itself suggests, it is asymptomatic. Here, the patients do not present with any symptoms. But when we get a urine routine examination done on a routine protocol screening basis, we on the urine examination see increased pus cells or leukocyte esterase being positive and nitrates being positive. So when this is there, we ask the patient to get a urine culture done. When the urine culture, when you're giving a sample for urine culture, it should be a midstream clean catch urine. That is, the initial part of the urine, what we start voiding, should be discarded to prevent contamination, and later midstream to be given. So, if there is more than 1 lakh colony forming units growth of the same species in the culture, then asymptomatic bacteriuria is detected, and we treat the patient with sensitive antibiotics. Now, that's a question that arises: is patient is asymptomatic, why we need to treat the patient? Because when the asymptomatic bacteriuria is diagnosed, it indicates that there is actively multiplying bacteria in the urinary tract. If left untreated, then it can cause on to complications like for mother. In 25% of cases, it will go on progressing into pyelonephritis, which is the infection of kidneys, and some cases do land up as cystitis. And for the baby, it can, in early stages of pregnancy, it can lead to miscarriages. Later, it can lead to preterm labor, premature rupture of membranes, and the infection of the membranes, that is chorioamnitis, which can also lead to low birth weight and IUGR babies. So it is important that we diagnose asymptomatic bacteria and treat it effectively. Uh, and then, according to the recent guidelines, ACOG guidelines recommends us to do urine culture at the first booking visit or the first visit a pregnant woman goes to the doctor for ruling out asymptomatic bacteriuria, pre-existing asymptomatic bacteriuria. But here, what we do is we do urine routine at the initial booking visit and follow it up with subsequent every monthly visits or each trimester. So when there is significant parameters that is seen like increased pus cells or nitrate, we get, or leukocyte esterase, we get a culture done and treat it accordingly. Okay, culture reports usually take 48 to 72 hours to come. Next in the thing is cystitis, which is nothing but the infection of bladder or the lower urinary tract infection. Here, the patient presents to us with symptoms: fever with chills and increased frequency of urination, urgency, and painful urination. Here, we ask the patient to get a urine routine and culture done. But even before the culture report comes, we sometimes start empirical antibiotic therapy because there are certain common organisms which are known to cause urinary tract infection, and susceptible antibiotics usually we started. If there is any changes, once the culture report is got, we upgrade the antibiotic based on the culture report. Next is pyelonephritis. Pyelonephritis is nothing but infection of kidney or the upper urinary tract infection. This is least common urinary tract infection that is seen, but the most severe when taken of a urinary tract infection category. This is the most severe one. It occurs in 1 to 2% of patients, usually in the early second trimester or in the late second trimester or the early third trimester. Okay, here the 20 to 25% of asymptomatic bacteriuria patients progress into this, and sometimes we, in 20% of cases with pyelonephritis, we have also seen that there is abnormality of the urinary tract in the mother, which we usually don't treat it in the pregnancy. Post delivery, we get a scan done and refer the patient, in case if it is still there, to urologist or the nephrologist concerned. Multidisciplinary team approach will be done there. In pyelonephritis, the patient do present with high grade fever, with chills, with rigors, and abdominal pain, especially back pain will be there in the lumbar region, increased frequency of urination, painful micturition, and they'll also present with nausea, vomiting, and preterm labor pains also. So here in pyelonephritis, there is no scope for outpatient treatment. We usually admit the patient because we'll have to give them IV fluids and IV antibiotics. IV fluids is given to combat dehydration because of fever. They'll not be having water, sufficient amount of water, and to combat dehydration, basically IV fluids are given, and also to flush out the toxins from the body and the bacteria from the body, we give IV fluids. And for the fever, paracetamol will be given, and IV antibiotics will be started, which will be given for a period of 48 to 72 hours. Meanwhile, we send all the investigations that is required, like CBC, complete blood count, renal profile, serum electrolytes, and the urine culture, and in severe cases, sometimes blood culture, and a scan to for the fetal well-being. Okay. Once the patient starts improving clinically, or we get the earliest culture reports also, we switch over the patient's antibiotic from IV regimen to the oral regimen between 48 to 72 hours. And then the oral antibiotics is continued for about 10 to 14 days after the, and we discharge the patient based on the clinical condition of the patient. After the completion of antibiotic, 2 weeks later we get a culture repeated to make sure that the pyelonephritis has been treated. If pyelonephritis is not treated, then there is severe complications. Like in for mother, there can be septicemia. That is, the infection can spread through entire body, causing septicemia, septic shock, and the toxins or that is released by the bacteria can spread to various organs, causing the damage to kidneys, liver, lungs, respiratory failure. Okay. So, and for the baby, it is preterm delivery, preterm deliveries, and low birth weight babies, IUGR babies. So, so it is important that we detect urinary tract infections in pregnancy and treat them, a timely management treating them. Okay. And then next is, can we prevent these urinary tract infections from occurring? Yes, to certain extent. First thing is, drink good amount of liquids. If you're not able to consume water, flavored water, juices, soups can be consumed. Second thing is frequently emptying of the bladder, maybe around 3 to 4 hours once, and washing soon after visiting the washrooms, washing yourself, and maintaining personal hygiene like vulval hair clipping. And if there is any white discharges, to be treated, to get the treatment of white discharge. And it is mandatory that we do urine routine examinations in your initial booking visit, and follow it up each trimester or every monthly as per your consultant's advice, so that we detect the urinary tract infections at the earliest and treat them accordingly. I think I've given you the brief overview of urinary tract infections, and why they're important, and how to treat them, and how to prevent them also. If there are any questions, I would be happy to accept it, or otherwise, I would like to end my session.
I think
Okay.
you can tell them
Yeah.
thank you.
So, since there are no questions, thank you. Thank you for giving me this opportunity to speak on urinary tract infections in pregnancy. Yeah, thank you.